In the early 2010s, we saw liraglutide approved for the weight indication under the brand name Saxenda. This is a once-a-day GLP medication that is still around for the treatment of weight that hasn't been as popular just because it was an every single day injection people had to do. And it didn't set itself apart as that much more of a potent weight loss medication compared to some of the newer agents. But as we've seen in the last, I was going to say a couple of years, but it's been, 7-8 years now at this point. But over the last few years, as we've seen these more potent once per week GLP medications become available, both for the treatment of type 2 diabetes as well as for the treatment of weight reduction and long-term weight maintenance, we've really seen the effectiveness and, following pretty quickly, the popularity of these medications.
Hello, everyone. This is Dr. Odoy with Oasis Women's Functional Medicine. I am here with Dr. Stoneback, and she is an obesity medicine specialist. And today we are going to be discussing menopause and use of GLP-1 medications in terms of weight management. Many of you know my stance with GLPs. I believe that they are part of the treatment package for a lot of women in menopause and perimenopause because weight loss becomes very challenging, and the things that used to work for us stops working as much. So without further time, I want to go ahead and have Dr. Stoneback please introduce yourself to the audience, and we can jump right in.
Absolutely. Well, thank you so much for having me. I love talking about GLPs. I feel like there is so much misinformation, and so I'm excited for us to clear this up. My background is in family medicine, and I was in a big primary care practice for years and practicing obesity medicine as well. About 4 years ago, we moved to Charlottesville, Virginia, and since that time, I've had a private practice where I support folks with medical weight loss. So I'm just doing the obesity medicine side of things right now, and it has been amazing to grow and support patients in this way. So I see patients in person in Charlottesville, Virginia, and then I see patients throughout the states of Illinois, Tennessee, and Virginia by telemedicine. And lots of people asking these menopause GLP questions. So I'm excited for us to dive into that.
Yeah, thank you so much. A lot of people think GLP-1s were just made, and I know it's not true. So can you tell us what GLP medications are and why were they originally developed?
Yeah, absolutely. So GLP-1 medications, as they're commonly known as, these are targeting the GLP receptor in the body. So the GLP receptor, actually we have many of them throughout our body, but the predominant locations are in the gastrointestinal system and in the brain. They do a lot in terms of regulating blood sugar and energy, how we metabolize our food, particularly carbohydrates. They also play a role in appetite signaling. These medications were originally developed for the treatment of type 2 diabetes. So we saw the very first one, Byetta. This was a twice-a-day injection approved in 2005 for the treatment of type 2 diabetes. Wow. And we really have a lot of good safety data. We have seen, as these medications have been studied then and approved for the treatment of obesity, a lot more popularity among them. But even that, there's been an evolution, many of them for type 2 diabetes. In the early 2010s, we saw liraglutide approved for the weight indication under the brand name Saxenda. This is a once-a-day GLP medication that is still around for the treatment of weight that hasn't been as popular just because it was an every single day injection people had to do. And it didn't set itself apart as that much more of a potent weight loss medication compared to some of the newer agents. But as we've seen in the last, I was going to say a couple of years, but it's been, 7-8 years now at this point. But over the last few years, as we've seen these more potent once per week GLP medications become available, both for the treatment of type 2 diabetes as well as for the treatment of weight reduction and long-term weight maintenance, we've really seen the effectiveness and, following pretty quickly, the popularity of these medications. But they've been around. They're not the new kid on the block. We've got 20 plus years of safety data for all these medications.
That is so reassuring because a lot of people just started hearing about GLPs, and so they think they are new medications. So a lot of the questions that I get is it safe? I heard this and that and the other thing about it. And so why do you think it's now why do you think this new attention to GLPs in terms of like weight loss and metabolism, what do you think shifted that, because it's been around 20 years. Why are we now all hearing about it in the last 5 years? What do you think created that momentum?
Yeah, absolutely. I think with anything, there's a tipping point, right? Just in terms of the way information spreads now with media and social media. Certainly these medications are more effective in terms of weight loss. So if we look at the average weight loss on some of the newer medications that you're probably familiar with, the semaglutide medications, which are Ozempic and Wegovy, the tirzepatide medications, which are Zepbound and Mounjaro, the effectiveness on these medications on average is in the range of 15 to 20% total body weight loss over the course of a year or a little bit more than a year, depending on which study we're talking about. And we saw with this effectiveness compared to before, some of them had in the range of a little bit more than 5%, 10%. And so that amount of weight loss is not as significant. We then saw people in celebrities, basically. We saw celebrities using these medications, seeing the effectiveness of these medications. And then all of a sudden there's this social concept proof of, oh my gosh, everybody I know, I feel like a lot of people feel like just everybody is taking these medications, but they see, okay, they're doing it and they're doing it. And there's that social proof of, okay, this thing, must be legit or must work. And so we've seen it really take a hold in a significant way.
Yeah, how have you seen it in practice in terms of shifting of, the typical metabolic syndrome, the visceral obesity, midsection obesity and blood sugar dysregulation and elevated blood pressure, like the whole metabolic syndrome picture? How have you seen GLPs really work in that context, even when someone is not diabetic yet?
Absolutely. Well, I think a lot of people are coming at these medications now for a weight perspective. And we know that weight is one of the symptoms of metabolic syndrome. And it's often a symptom that, for one, you can see on your body. It's a symptom that, we're aware of our clothing size, we're aware of the number on the scale. And so a lot of people are really tuned into that symptom. It's also one you can check on your own. You don't have to have your blood drawn. There's no fancy testing. You just step on your scale or you try on your clothes and you see that they're fitting differently or there's a larger number on the scale. So when we think of weight gain, that is just one symptom of our metabolic health, and it's the one that people are often most aware of. But as we were saying, it's really this spectrum of other conditions as well. And I don't think a lot of people are always aware of that full picture because we are looking at other pieces, right? We're looking at the blood sugar, we're looking at the hemoglobin A1C, which tells us about the blood sugar over 3 months period of time. We're looking at cholesterol or lipids, particularly the LDL or bad cholesterol, the HDL or good cholesterol, and the triglycerides. Those, of course, it's more complex than that, but we sometimes boil them down to those simple terms. We look at liver health. So are your liver enzymes elevated? We look at things like blood pressure. And then this visceral adiposity, as you're saying, a lot of times people notice not just, okay, I'm gaining weight, but I'm gaining weight in that midsection. So noticing I'm gaining weight in that way. And so one of the amazing things about these medications is they're not just helping you lose weight, they are treating that underlying metabolic dysfunction such that we see improvement, we see decreases in weight, but we see improvement in blood sugar, in blood pressure, in cholesterol, in liver health. A lot of times we see these improvements across other areas as well. And it's really powerful, the shifts that ultimately can end up having when we look at health outcomes. So they are pretty amazing medications. There's a reason they've been so popular.
Yeah, I definitely agree. I treat women in menopause and perimenopause, and we see this shift happen when we get to perimenopause and menopause because of changes in estradiol and production of estrogen and progesterone. We see a shift or increase in cortisol and just gain of weight. And a lot of the women I see tell me that well, I'm doing the same things I've always done. I'm exercising. I'm eating the same foods I normally ate. And this 10 pounds or 15 pounds or 20 pounds is just not budging, right? And that's what makes me really reach for GLP in those regards, like especially with we also see a shift in lipid profile during menopause and perimenopause. It's really interesting because they say, well, I've not changed how I eat. Why is my LDL going up? Why is my cholesterol going up? And it's related to changes like hormonal changes in menopause, but it becomes so difficult. So what are your thoughts with GLP and especially during menopause? Have you seen some of these things that I'm talking about, or is it just here in Rochester?
Oh, absolutely. I think that's, we see this very distinct shift, and it feels like it happens overnight, both in terms of, from the patient perspective, it's like, oh my gosh, I gained, sort of 10 pounds, 20 pounds overnight. And that it truly, a lot of times within months at least, sometimes we see these shifts. And then the labs too, we look at a trend year over year, and you see this very distinct, okay, they've never struggled with cholesterol. Their blood pressure has always been perfect or maybe even low. And now all of a sudden we see those numbers creeping up in a way that they never had before. And so 100%. And I think, when we think about treating those things though, the GLPs, and I think where we often miss the mark as a society is that while GLPs are an amazing tool to have in your toolbox, for when they are just one tool, we want, you don't want to just have a hammer. You need to have all the other tools in your toolbox. And we want to be thinking about them in a long-term use way. So I think one of the problems is when we approach it from a weight standpoint of let me take a medication that helps me lose weight, then I lose the weight, then I stop the medication. We are not doing anything to permanently correct the underlying metabolic health when those medications are used in a vacuum. So using them alongside other tools, with nutrition, with movement, with sleep, maybe with hormonal management, these other pieces, as well as thinking of, okay, not just, okay, I've hit a weight goal, and so therefore I'm going to stop these medications, but do I need to be thinking about these in a longer term way to continue to support my underlying metabolic health, not just for the weight, but for the cholesterol, for the blood sugar, for the blood pressure, for all of these other pieces.
Absolutely. And yeah, thank you for all that explanation. It's really helpful. So for a lot of women, and I like that you hit on it, that it's one of the tools in the toolbox, and it's not just, the GLP, but the nutrition. So what are some of the nutrition or some of the things that you look at for a patient on a GLP, especially when they're in menopause? What are some of your advice regarding nutrition, and how does one safely take a GLP during menopause?
Mm-hmm. Absolutely.
And I think maybe it's a vague question, but I think what I'm trying to get to is like, in menopause, I encourage women about muscle loss. And we know sometimes with the weight loss comes muscle loss and, fat loss, which we like the fat loss, but there is also muscle loss that happens. And so here I am telling women, in menopause, in perimenopause, we need to be mindful of muscle mass. So how do we juggle the two?
Yeah, absolutely. Well, you hit the nail on the head.
What are some of your thoughts? Yeah.
Yeah, I think a lot of times we have this idea that we want to lose weight, but the reality is you don't care about weight loss, you care about fat mass loss. And so what are the things that we can do to help your body so that you are going to preferentially lose fat mass while ideally maintaining your muscle mass? There are people who are talking about gaining muscle mass. That's nearly impossible to do during a weight loss journey. And even maintaining can be really challenging as well. We know that there's some natural decline in muscle mass as our body becomes smaller. You could imagine, let's say you lose even 20 pounds. If you were carrying around 20 extra pounds all day long in everything you do, going to the shower, going to the mailbox, going for a walk, all of your daily activities, you're carrying around this extra 20 pounds. There is an amount of muscle that's associated with that. So there's this amount of muscle that your body puts on just in carrying that weight. So as we decrease weight, we may see that, hey, I don't need as much muscle to carry around my new smaller body size, but you want to make sure that you're not disproportionately losing muscle. And so how do we protect that? And it's exactly as you said, like we're really thinking about protein goals. So you know that protein is one of the most important things for building and supporting our muscles. Our bodies don't have great ways to store protein. So it's not just, hey, are you getting protein, but are you getting it distributed throughout the day? So a lot of times I'm talking to my patients about getting 2 or 3 servings of protein per day and getting 20 or 30 grams of protein at each serving. Now we can sit down and do some calculations, and I usually recommend doing this with your physician, with a registered dietitian, but based on your current body size, based on your ideal body weight, based on your level of activity, what is a protein goal for you? And those numbers will vary really broadly. So it's sometimes difficult to talk about in the setting here, but a lot of times aiming, like I said, 20 to 30 grams, 2 to 3 times per day is going to be a really nice jumping off point for most people. And so that can be an amazing tool for building, supporting muscle mass, as well as helping to signal satiety, because protein really helps with that fullness signal in our body. So it helps us get full and stay full for longer.
Yeah, and the good thing too is that the GLPs suppress your appetite, correct? That's the main mode of action, right? And so now I can only imagine if you eat more protein and it increases your satiety and you're on a GLP, which is also suppressing your appetite. Now you have those double things, 2 things working for you. And so what are some of the changes or, side effects or things that you've seen with the use of GLPs?
Absolutely. So from a side effect standpoint, I think what's important to know is that many people do have side effects, especially early on in their journey, but they tend to be mild and they tend to improve over time. So when we look at the most common side effects, nausea is always the most common one. Stool changes, so both constipation or diarrhea. Sometimes it can be alternating, which can be a little bit frustrating. There can be other things like indigestion, acid reflux, sometimes burping or belching, vomiting is rare but does happen. So those tend to be the most common side effects. We do see sometimes other ones like injection site reaction, where you get redness around the injection site. Sometimes after months, people notice things like feeling a little bit run down or hair changes, and we can often talk through ways we can support that. But the good news is that almost all of the GLP side effects are manageable. And so with really good strategy, we can help patients to be successful with them. So when we're thinking about nausea, we're making sure that patients are drinking regularly, so getting adequate hydration, getting electrolytes, getting protein. Sometimes you're nauseated and like, should I eat? Should I not eat? You're not quite sure what that will look like. And so we often will emphasize what we call protein liquids. So that can be things like protein shakes, protein waters, yogurt, broth can be a really nice option, soup sometimes, as well as really gentle proteins like eggs, for example. So sometimes at the beginning, it's like, hey, I need to eat carefully. But then over time, feeling like you're really, my goal is to support patients in eating good protein, eating good fiber, and feeling like they're able to eat food that fuels their body, nourishes their body, and when they're eating, that they're able to eat an appropriate amount, that they don't feel over hungry, that they're able to end the meal at an appropriate time, and then not having a lot of cravings and food noise in between meals.
That's very helpful. So I want to revisit the topic with hair loss. Is that sometimes some women experience? Is it related to the GLP medication itself, or the lack of enough protein that's causing, or lack of enough nutrition because your appetite is suppressed, so you're not taking in a lot of calories to begin with. Like, what is the reason for the hair loss that we see sometimes with GLPs?
Yeah. So the good news is it's nothing about the GLP medication specifically, but we do know that rapid weight loss is a major trigger for hair loss. So a lot of times we put this in the category of telogen effluvium. So our body has gone through some major transition and responds to that with a alignment of the hair shedding cycle. So a lot of hair will shed at once, and people come in, they'll come in. I've had people bring in, Ziploc baggies full of hair of like, this is just how much hair came out this morning, for example. It can be really significant. And so not to minimize it, but it's a very common thing that happens for any major transition. So this is, you've had a baby, and a lot of times you're 4 to 6 months postpartum and a lot of hair will start shedding. That's a very common trigger. Rapid weight loss being another common trigger, whether it's GLPs or honestly rapid weight loss for any reason. We see this in the bariatric surgery population a lot, even in patients who are in a non-medicated weight loss journey. If they have rapid weight loss, they will often have this telogen effluvium that happens. But the important thing is, and you were sort of alluding to, is do we have nutritional building blocks to support healthy hair growth? And so you want to be thinking about protein, you want to be thinking about iron, you want to be thinking about some of those healthy fats, you want to be thinking about a lot of our micronutrients. So things like even zinc, for example, can make a difference. So what I will typically recommend is, are we getting protein in the diet? Are we getting iron in the diet, particularly if someone is still having regular periods and bleeding? And then are we supporting someone with a multivitamin? So at the very beginning of the weight loss journey, I just have everybody pick up their favorite over-the-counter multivitamin as a sort of fail-safe, get all the micronutrients, make sure that we're going to have those supported, because that can be important. You still may have the telogen effluvium, so it may not stop it from happening, but the hair should regrow. We want to just make sure your body is adequately nourished to be able to regrow the hair.
Also, you see typically that a lot of women regrow the hair once their weight balances out.
Very commonly. And if it doesn't, there can be other scalp disorders that are going around as well. And so is there any sort of dandruff, is there any sort of like seborrheic dermatitis was the word I was looking for, but are you having dandruff, for example? Are there other inflammatory conditions of the scalp? Is there any signs of aging scalp, for example? So if someone is having hair loss that then persists and they're not seeing hair regrowth, a lot of times that is a good candidate to meet with a dermatologist, for example, and discuss, are there other things that we really could be doing to support the hair regrowth process?
Absolutely. And I think that with GLPs having that anti-inflammatory effect, if it's an inflammatory reason, maybe that could cover it. And also for a lot of women in perimenopause and menopause, then it's important to look at your hormones too, because loss of estrogen and progesterone can also lead to the hair loss, or even changes in the DHEA and testosterone can also cause some of the changes we see with hair, menopause, just in general. So it becomes very, like a game of let's find out what led to this. So if there is someone who is like, well, I love this idea, I just have 20 pounds. I don't meet criteria in terms of I'm not diabetic. I'm also not, I don't fall into the BMI category for obesity, but I'm also in menopause and I'm struggling, right? Which is a lot. Every woman in my office in menopause is struggling with weight in places they don't particularly like. So what do you say to that woman who has, doesn't meet criteria, but has that weight that won't budge? They've done all the CrossFits, counted their calories, they've done everything. What do you say to her?
I would say see someone like you or I. There are people who are experienced in this area and are willing to help. And I think one of the realizations is that this may happen sometimes outside of a traditional busy healthcare system. A lot of times if you've got 15 or 20 minutes with your doctor, there may be too many things to address or to go into the nuances of how do we make sure to support you in this comprehensive way. I think one of the biggest challenges that we're running into right now is there's a lot of very cute and appealing advertising on social media for companies that'll just, ship you a GLP medication, and, you're the boss of your own body. Like, I believe in patient advocacy and, autonomy to make those decisions. And having someone who can be a partner with you in your journey is just invaluable. And so finding someone, that may look like, I'm an obesity medicine physician, that may look like someone who specializes in midlife women's health, that may look like, someone like yourself in functional and lifestyle and, some of these other pieces. And it can be really powerful when you have the support of someone who knows what they're doing and can help you in a way that not just helps you lose weight, but actually improves your health alongside the weight loss journey.
Absolutely. I think it's just one piece of the puzzle, because if we just fix your weight and you lose a bunch of weight, you lose a bunch of muscle mass, but we don't balance your hormones properly, now you have issues with bone health and heart health and all these things that just, losing weight does not really address. So it's important to get in touch with like a professional, someone who is actually looking at your individual case rather than just shipping to your door. And it has its pluses and minuses, I guess. So, so are people stuck taking GLPs forever? Like, if do you have to, I can see if someone has type 2 diabetes, hyperlipidemia, and elevated blood pressure, and they go on a GLP and it gets rid of all these 3 medications. I see the clear win there, and I say, well, you have to take it, because it's helping all these conditions. But what about the woman or the man who is just, on it for weight loss, strictly weight loss? Are they stuck on it forever? Yeah, I hate to use the word stuck. It just gives it a negative, but do they have to take it forever?
Yeah. The short answer is probably. So when someone comes into my clinic, I really like to talk to them about, are they at least open to long-term use? You don't have to decide on day one that, okay, I'm taking this thing for the rest of my life, but I want to be open to the possibility that, like, let's say it's going really well. Let's say it's continuing to support me in the way that I want to. Is it a problem for me to take that medication long-term? So at least want there to be an openness in using it in that long-term fashion. But we absolutely know that there are people who do wean off of these medications, people who do stop these medications. And so that is a possibility as well. I think a lot of people in starting have this idea that it'll be a short-term thing, but then they actually start the medication and they're like, oh my gosh, I love the way that I feel on this medication. Especially if we're able to have them on, sometimes like a low dose of medication that allows them to have decreased hunger, decreased cravings, but still allows them to eat in a way that their body feels fueled and feels nourished and feels energized and feels really good. People will notice sometimes other effects of, they might have less desire, cravings for alcohol and that type of thing. And so there's other benefits that come up alongside of it. So what I like to say is, let's start low. So of course, everybody starting out should start on the lowest dose of medication. When I'm making a decision to move to a higher dose of medication, I'm looking at, okay, what are we seeing in terms of weight? What are we seeing in terms of the way the medication feels in your body, both in terms of effectiveness as well as in terms of side effects? Are we seeing that there's any issues that come up from those standpoints? And then from there, we can make a decision of, do we nudge the dose upwards? And then as someone's hit their weight goals, okay, what is it feeling like in your body? Are you needing to lose have you lost more weight maybe than you need to, which is kind of surprising, but does happen sometimes. And so then we're dialing back, maybe taking the dose less often, taking a smaller dose of medication. So we kind of slowly will stair step up. And then if we need to, stair step back down, but doing that in a slow and gradual way so that a patient doesn't feel like, oh my gosh, I no longer have the support of the medication. And it is safe to stop the medications abruptly. So let's say someone became pregnant or someone had a severe side effect stopped and needed to stop abruptly, they absolutely could. But typically, if we are choosing to wean off of it because someone's like, I'm not sure if I want to take this long term, doing that in a gradual fashion tends to be the best way to trial that.
Nice. I like that. And in functional medicine, we do the probiotics, the Akkermansia, which increases the natural production of GLP. So I look at that for a crutch, in terms of the woman who wants to be able to wean off. I say, well, we can try this probiotic and see if we can replenish your gut of the GLP, bacteria, Akkermansia, and see if that helps so that we can safely wean you off of it. But I think there'll be a time where, in treating the menopausal women, it will be, here's your estrogen patch, here's your progesterone, and here's a low dose GLP, just to keep people healthy and just stop that food chatter and keep them stable, if you will, and from a standpoint of managing chronic disease. So this was great. I think we've covered a lot of ground in terms of GLP and the different types and risk and side effects and the benefits. Is there anything else that you'd like the listeners to know about when it comes to GLP and menopause?
I think recognizing that, as we were talking about earlier, getting support during your journey. I mean, for one, don't be afraid to ask for help. I think in the weight space, we as a society have a lot of bias. There's a lot of shame, a lot of stigma of like, I should be able to do this on my own. If I just worked harder, if I just tried harder. And then even in starting the GLP journey, a lot of times people feel like they need to do that alone. Like they feel ashamed. A lot of times they've had experiences even in healthcare where they've brought it up with a physician and made to feel badly or, shamed about the using a GLP medication. And so I just want to encourage our listener to be an advocate for herself, ask, like if you ask a physician, like let's say you ask your primary, hey, could I be on these medications? And if they, throw a lot of shame at that situation, I would say, is there someone else that you recommend? Like if you don't feel comfortable prescribing these medications, is there someone else in this community that you would recommend that I see who's an expert in these? Because I'd really like to try it. I want to make sure that I have support. So being an advocate for yourself, spending some time looking at what are the practices local to you. When you can have that partner, it can absolutely change the experience. And like I said, not just lose weight, but actually improve your health, which is, really ultimately the goal here.
Absolutely. Thank you so much. Yes, the message is be an advocate for yourself. And a lot of primary care physicians don't have the time or resources to support GLP weight loss. And that's why specialists like Dr. Stomba exist. And so tell us again how people can find you and the states that you are licensed to do telemedicine, because I love everything that you do and how you are a big advocate for women when it comes to being our self agents. So tell us where we can find you and what some of the fun things you have going on. I know there is a course, and so please tell us more about all of that.
Yeah, absolutely. Well, my goal is to support patients in their weight and their overall health. And I see patients throughout Virginia, Illinois, and Tennessee by telemedicine. So you can find me at www.sarahstomband.com. As you were mentioning, I do also have an online course, and we often have people reach out who have questions or looking for more support on their GLP journey. And my goal was, let me just put this into one place. So this is an online video program program that has answers to all of the most frequently asked questions. So if you are traveling with your medications, if you're wondering how to inject your medications, you're dealing with nausea, or wondering about protein goals, people are commenting on your weight. I mean, we have like 60 videos discussing all of the different things that you want to know during your weight loss journey. And at this time, it's only $149 for 1 year of access. So my goal is to put it into the hands of just anybody who needs support, anyone who's looking for a little bit more and isn't necessarily getting that from their healthcare team, or maybe they've bought the medication at a med spa or online. I still want to be able to help you. So you can find that at my website as well, www.sarahstombaughnd.com/GLP, and that'll bring you the information to purchase that guide, because that's a great way to get supported on your journey.
I really love that idea, because there are often a lot of patients who get put on the GLP and are left to figure out the side effects or figure out everything else that comes with being on the GLP. And it leads to failure of treatment, because they just stop using the medications because they ran into side effects and there's no support. And so I really love that idea. Take the course if you are thinking about starting a GLP medication, so you are well educated about the process, and it also will help you when you find an online store or someone who will ship to you online. It will give you some information and knowledge to know what to look out for and what questions to ask, so that you do what is safest for you while you are pursuing a healthy lifestyle in general. Well, thank you so much, Dr. Stombau. I really appreciate you spending this time with us. Thank you for coming. And